And this morning, we're going to be taking a closer look at men's health. Here's ABC 15's Nohelani Graf.
In this morning's Health Insider, we are focusing on men's health. Sometimes it is hard to get the man in your life to go to the doctor, but there is also new technology that maybe could help with that. So joining us this morning is ABC 15 Health Insider, Dr. Shad Marvasti. Good morning.
Good morning, Noelani.
I don't know why it is, but it is tough to get men to go see the doctor. But it's important because we talk all the time about all the different checkups regularly that we need to have, the numbers you need to know.
Absolutely. Unfortunately, men are less likely to go see a doctor, less likely to get treated or have any preventive services, and more likely to get diagnosed in later stages for things like cancer, heart disease, or diabetes because of their reluctance to go in and be seen.
Right. When we're talking about early detection, cancer often comes to mind. April is actually Testicular Cancer Awareness Month, so that targets men directly. And I know a problem a lot of times is men just simply don't want to know. They're afraid.
Absolutely. And, testicular cancer in particular, it's the most common cancer in men between the ages of 25 and 40. And so really, it's really one of those things that if you're in that age group, you have this sense of invincibility, right? And you're kind of feeling in your prime, you're healthy, you're doing your life, whatever you want to do, but you may not think about an illness, right? Or do I have something that could potentially kill me, right? And so getting that annual checkup is really important, and even just doing testicular self-exams, just to have familiarity with your body. And if you notice anything that's different or out of the ordinary, I think that's one good general rule of thumb, not only for testicular cancer, but anything, anywhere. If something just seems odd, it's not the same as usual, whether it's you notice a bump or a lump or just like a symptom that's like not going away, that's a good time to come in and see the doctor and just ask.
Now, there is some new technology that can also help with kind of a one-stop shop, if you will, things like full body scans.
Yeah, so that's something that's really starting to develop with the advances in imaging technology, as well as calculations with artificial intelligence combined with new genetic tests, as well as tests of our microbiome and other blood tests for looking at markers for cancer. We're really starting to get to a really new stage where we're starting to even be able to detect certain cancers and certain other diseases at the level where it's so, infinitesimally small that it would normally not be detected on routine tests. And in that case, as we get to that point, and as this technology grows and it becomes more accessible to more and more people, you're going to get to the point where you're going to have like a Star Trek reality, right? With the tricorder, right? Where you're just going to do that scan and you're going to be able to find something well before it would ever show up in like a colonoscopy or something like that, and then be able to nip it in the bud. So I think it's really an exciting time with the development of some of these technologies.
Yeah, it's something to look forward to because right now, certainly it's expensive. Health insurance doesn't cover it. But for some people, it is still an option. So like you said, when it becomes more widely available, it could completely change the health landscape. But with that, of course, we also always have questions that we want to ask to make sure that it is right for you.
The downside of things like that are sometimes we find, from a scan, like something called an incidentaloma, basically like an incidental finding, right? Where we don't know what it means. And then it kind of makes us go down the rabbit hole where we have to search and try to find something. And those tests can be not only stressful and anxiety provoking, but potentially harmful, right? So I think there's a balance there, and having that conversation with your doctor to see what's out there. If the cost is really high and the return is questionable, right? It's not something you want to do. But if it looks like it's nowadays you can get a full body MRI scan for several $100s. It may be something you want to explore, but again, that's something that you should have that conversation with your doctor. And testing for the sake of testing is never a good idea. But with that said, as our technology advances, being in the know, right? Knowledge is also power too.
It would be far better to find out now than down the line, not just for you, but for your whole family, that peace of mind. So important talks to be had, definitely to take control of your health. Thanks, Dr. Shad.
Thank you.